A new study published today in the journal Pediatrics comes out of our region, and it finds fewer children may actually need ear tube surgery for chronic ear infections, a practice currently considered more standard and one that is endorsed within the American Academy of Pediatrics. Isabel Garcia joins us now in studio with insight from the local doctor at the helm of this study. Isabel, what have you learned?
Yes, Adam, Dr. Michael Pichichero is the director of Rochester General Hospital's Research Institute, which is behind this study. And he says this is a fairly common procedure and is considered minor, but does require some anesthesia. He's hoping this study will open a discussion within the pediatric and otolaryngology community about the necessity of this surgery. A study published on Monday in the journal Pediatrics finds that fewer children experiencing ear infections may actually need ear tube surgery. Currently, the qualifying threshold for a child to be recommended for ear tube surgery is if they've had 3 ear infections within 6 months or 4 ear infections within 1 year.
All these years, for decades, doctors and parents thought that when the tubes were put in and the ear infections stopped, it was because of the tubes. Our study shows they were going to stop anyway.
Director of Rochester General Hospital's Research Institute, Dr. Michael Pichichero, and his research team followed about 300 children from the age of 1 to 3. The results: 90% of children who would have qualified for ear tube surgery but did not move forward with the procedure had their infections clear up.
Well, if it took 6 months to get 3, and then you go to the ear, nose, and throat doctor, and then you get the surgery scheduled, and then you have the surgery, by the time that window is over, the ear infections were already over.
Dr. Pichichero notes these findings were done through statistics, and this new approach is now included for additional resources for those within the medical community.
Importantly, within our article, we include an algorithm where doctors can put in the age of the child, daycare or not, the number of ear infections when they put in the data, and our statistics will tell them how many more ear infections the child is likely to have.
And Dr. Pichichero also says the scope of these findings is widespread, as he says about 500,000 children get ear tubes in the U.S., which consumes more than $1 billion in medical costs each year. Adam, back to you.
Isabel, thank you. Also of note here, this study was accompanied by an editorial in the journal Pediatrics. The doctor says that indicates the American Academy of Pediatrics places a high value on the study to have the potential to change care for children in the U.S. and potentially across the globe.